A serious concern as it witnesses a massive surge in COVID-19 cases. India Today speaks to Dr Sudarshan Ballal, the chairman of Manipal Hospital and the member of COVID expert committee, and what is really turning Karnataka right now into a COVID epicenter. Nolan Pinto brings us more.
In the last 24 hours, we actually saw this massive surge in the state of Karnataka, 50,000 plus cases recorded in the state. But Bengaluru in particular, very worrisome. We have crossed 23,000 cases. Why are we seeing this surge, doctor? What could be the particular reasons for this?
It's very disturbing that Bangalore now has the dubious distinction of being the COVID capital of India. And certainly Karnataka also has 50,000 plus cases. This is quite disturbing. And in our opinion, I think there are multiple reasons for this. The first and foremost is failure at all levels, starting with the neglect of the people of COVID appropriate behavior and absolute disregard for masking, distancing, avoiding crowds. Second, failure of the system to implement the COVID appropriate behavior, and certainly the rallies, protests, elections, religious festivals caused a huge super spreader events, and the spread was across the country. And India is a very vast country and densely populated. So if there's a fire in your neighbor's house, it'll definitely come onto your house and you'll catch fire too. And that's what's happened. That's the first and foremost reason. I think complete disregard for COVID appropriate behavior and letting our guard down too soon, and non-implementation of COVID appropriate behavior, which now obviously the authorities have woken up to and doing something about it. The second, I think definitely the mutant strains probably had a role to play. And if you see that there are multiple mutants, including the British variant, the double mutants, what they call as the Vidarbha variant, all of them certainly seem to be more infectious in the sense they spread much more rapidly than the original corona. And we do not yet know if they are more deadly, but certainly the spread is very rapid. It's very disturbing that 30 to 50% of the people who have been tested in various cities between Delhi and Bangalore are positive, which means even God cannot prevent this pandemic. About 50% of the population in a city like Bangalore will be almost 60 lakhs of people. Even the best of healthcare infrastructure cannot cater to 60 lakhs or 6 million people who have these infections. So if the positivity rate is 50%, it's very alarming. And the only thing we can continue to do is indulge